My late husband, Bud McCaig, was a sufferer of arthritis. And so part of what the work that he did was because he was a sufferer. He knew what it was like. And he knew that we wanted to be able to attract doctors that were leading their field in research. And Bud worked very hard at raising the money.
Calgary has quite a unique model compared to other cities in that we don't have a separate hospital foundation for each of our hospitals. That was a visionary structure that was implemented 30 years ago when the Calgary Health Trust was first formed. If we can have some truly transformative options for community members to bring their support, those will really inspire the greatest level of philanthropy. So we're working hard to identify big, bold, transformative opportunities so that we can invite the community to come and help us solve those problems. That's what's exciting about the future, I think, and I know that we'll be able to grow our fundraising outcomes and our impact by setting our sights even higher than we have in the past.
They arrived at 27 weeks.
They were very early and very sick.
I think you expect they're going to be tiny. I don't think that's the surprising part. But what's surprising is all the complications, all the equipment, how many machines are required to keep a baby that small alive at that gestation.
We can't thank you enough, right? Those donations went towards equipment or training for the equipment that kept them alive.
When he told me that I would walk in the morning and walk out at night, that night I would walk out of the hospital on my own, I was blown away. That was unbelievable. At that point, I was in the most pain that I'd been in my whole time.
It's not luck or fortune that Cale is here to talk about it today. It's expertise and knowledge of the people in the ICU and emergency services and everything else. We're not lucky to be here. We're here because all of those people along the way chipped in and were vested in a positive outcome just like us.
From an ICU perspective, we've been very fortunate to receive a donation from the Calgary Health Foundation and its donors to fund a neurocritical care expansion project. And through that expansion project, we've been able to expand the reach of neurocritical care by educating frontline healthcare providers and training the next generation of neurointensivists. And that's all thanks to Calgary Health Foundation and its generous donors.
The cath lab is really an essential part of, cardiac care in Calgary and in any big city. They provide us the information we need to treat these diseases appropriately.
The women's health team in Calgary has had a dream for many years about what healthcare could look like for women. What was holding us back was a lack of financial resources. We're going to start moving on those best-in-class care models, and we want to be responsive to the growing and evolving needs of women in our community.
Because of you, the future is bright. For 30 years, your generosity has fueled progress, transformed care, and brought hope to countless lives. As we look ahead, innovation will continue to lead the way, shaping a healthier tomorrow together.